Hello, I'm Tova. I am a registered associate marriage and family therapist, super passionate about using creative tools and processes to help adults grow in various areas of their lives and achieve wellness and well being in body, mind, and spirit. In this video, I'm going to give a little overview of drama therapy. I graduated from a master's level drama therapy program, and people will often ask me what drama therapy is when they hear that I went to school for drama therapy. And I laugh a little to myself because I think that the answer to that question is fairly complex. I mean, I went through a 2.5 year program to learn what drama therapy is. And also, just practically, there really isn't one way to do drama therapy. But to start off, as far as answering that question, NADTA, which is the North American Drama Therapy Association, answers the question as follows. This is directly from the NADTA website. They write that drama therapy is the intentional use of drama and or theater processes to achieve therapeutic goals. Drama therapy is an embodied practice that is active and experiential. This approach can provide the context for participants to tell their stories, set goals and solve problems, express feelings, or achieve catharsis. Through drama, the depth and breadth of inner experience can be actively explored and interpersonal relationship skills can be enhanced. End quote. So that's a pretty good definition. Um, I sometimes will point people to the NADTA website when they ask me what drama therapy is, because I think NADTA answers it pretty well. And I would also add, or maybe rather clarify, a few things, at least to kind of further refine how I think of and use dramatic and improvisational processes in a self-growth context. So I actually come from a really pretty strong background in improv. That's kind of what propelled me down the road to drama therapy. So first point is that being active does not have to entail getting up and moving around, although it certainly can. There's this whole embodied cognition element that I think is really pretty prominent within drama therapy. Perhaps that's another video. But in any case, discussing our human experiences in creative and divergent ways, that can be drama therapy. So using story, using metaphor, that can be drama therapy. So can using imagination, visualization, and these can be done while you are remaining seated. That can be drama therapy. And that's a really important point because people have different ability levels. Not everybody is able to get up and walk around or move around in the same ways. Also, really important, maybe on the more philosophical side, is that sitting and being still, those can be extremely active and difficult experiences. So, kind of this idea that we're never not doing something. As long as we are alive, we are always doing something. It might not necessarily be a very overt something that we're doing, but just that idea that we're always doing something, even if it's just sitting still and listening or staring at a wall. Another point, I think that a huge power of drama therapy is being able to explore intrapersonal relationships. So intra is different from interpersonal. Intra is more internal. Inter is like, social and like with other people in our lives. Intra is kind of more how we relate to ourselves. So I'm really big on this idea of healthy inner multiplicity, exploring our inner parts of self or inner roles that we can kind of slip in and slip out of in different contexts and in different times of our lives. Another important point is that it's not just feelings that are expressed, right? So wants, needs, thoughts, many inner experiences can be concretized in drama therapy processes. So concretize, what does that mean? So to concretize is to make the invisible visible in some way, such as through verbalization, like speaking, embodying a character or a role or an inner part of self, or in some way representing these kind of unseen elements, like such as a felt quality to a relationship that you might have in your life, like by using some kind of a physical representation of it. Scarves are one way to do that in drama therapy in a more active way. Social atoms, which are a tool from psychodrama, can just be done. They can be done in an embodied way. They can be done on pencil and paper. Those are just some examples of ways to concretize inner experience. And then a final point that I want to make is that within the drama and or theater processes that Nata mentions, I really want to include improv specifically. Like I said, I've been doing improv for a while. Improv has a huge potential to facilitate self-growth, communication, embodiment, creativity, divergent thinking, and so much more. So those are just some of my thoughts on drama therapy, going off the really strong definition from Nata. And also, I want to just point out that for me, I integrate other concepts and processes with drama therapy, right? I have this very holistic approach. I'm really big on embodiment, which is essentially centering the role of the physical body and wellness and well-being. And that can be done in different ways, right? Thinking about sleep, thinking about how we're nourishing ourselves, thinking about how we're moving and bringing movement into our lives. I'm also really big on cultivating creativity and flexibility to foster self-growth, personal development, and insight. So I hope that gives you a little bit more insight into what drama therapy encompasses and a little bit about how I personally think about and use drama therapy and drama therapeutic processes. So thank you for watching, and I will see you next time.